In our previous video, we discussed how trauma can affect children and parents, including the importance of seeking treatment if your child is having difficulty. When it comes to a physical injury, like a broken arm, you're probably familiar with the necessary treatment. Set the bone, wear a cast for several weeks, and then maybe receive some physical therapy to help you regain strength. But if you're caring for a child who's experienced a traumatic event, you might be confused or just unfamiliar with the available treatment options. So in this video, I'd like to introduce you to a highly effective treatment for child trauma called Trauma-Focused Cognitive Behavioral Therapy, or TF-CBT for short. I'll discuss the basics of TF-CBT and give you an idea of what you can expect from treatment. Just as medical doctors have developed effective methods for treating a broken arm, therapists have developed interventions to successfully treat the effects of childhood trauma. One of these interventions is Trauma-Focused Cognitive Behavioral Therapy, or TF-CBT. TF-CBT has been researched in over 20 studies, which have shown that it works, helping both children and their parents heal after a traumatic experience. In fact, TF-CBT has been studied more than any other child trauma treatment, and it has the most scientific evidence showing that it helps children and families recover. These findings have led TF-CBT to be designated as an evidence-based treatment model. It's now a gold standard for treating the effects of childhood trauma. So, let's talk about TF-CBT. TF-CBT is provided by therapists who have been specially trained in the model. It's for children ages 3 to 18 who are exhibiting changes in their thoughts, mood, or behavior after experiencing a traumatic event. And TF-CBT was originally developed for children who have experienced sexual abuse, but since then it's been used to treat the effects of many different kinds of trauma, including treatment for children who've experienced multiple traumas. TF-CBT is designed to be a short-term therapy, so treatment won't go on forever. At the same time, change doesn't happen overnight. So if your child participates in TF-CBT, the therapist will probably want to meet with your child for about an hour or so every week. And if your child attends every week, therapy typically lasts from 3 to 6 months. A really important part of TF-CBT is the involvement of a parent or a caregiver in the therapy. Having a supportive caregiver plays a huge role in helping children recover from trauma. So in TF-CBT, parents or caregivers meet regularly with their child's therapist. You'll talk about parenting, you'll learn the skills that your child is learning, and you'll also figure out how to support your child. TF-CBT also provides parents the opportunity to work through their own thoughts and feelings about what's happened. So sometimes your child's therapist will meet with your child alone, sometimes with you alone, and sometimes with the two of you together. Research has shown that when parents are involved in the therapy appointments, it has a bigger effect on children's behavior problems and depression than when parents aren't involved. And it also helps parents themselves to feel better. So for a number of reasons, your involvement in your child's therapy is very important. So TF-CBT is organized into 3 phases. They work like building blocks. So each phase builds on and uses what's happened up until that point. And each phase of therapy is important to your child's healing in a different way. The first phase is skill building. So during this phase, your therapist will help your child learn and practice new coping skills. These are going to be skills that your child can use in daily life, but also to deal with the thoughts and feelings that come up around the trauma. And you and your child will also learn more about trauma, about why it happens, and about the effects that it has on children. During the second phase of TF-CBT, your child may have the opportunity to talk about what actually happened during the traumatic event and to tell his or her story. This only happens after your child's mood and behavior are stable and your child is more prepared to talk about what happened. We naturally want to avoid talking about scary or upsetting experiences. But many youth who've been through TF-CBT say that talking about what happened was actually the most helpful part of treatment. By talking about it, your child can put what happened in context and loosen the hold that the trauma has. The strong feelings that might come up right now when your child talks or thinks about what happened will start to subside. And this is a really important and critical part of healing. In therapy, telling the story happens in a gradual way, and your child's therapist will help him or her use the skills that have been learned in therapy to cope with any strong feelings that might come up. Last but not least, the third phase of TF-CBT involves pulling it all together. Your child may have the opportunity to share his or her trauma story with you. Your child's therapist will prepare you for this and make sure that you are ready first. Your therapist will also help your child overcome any lingering fears related to the trauma. And finally, your child will learn safety skills, which provide tools for recognizing and handling potentially unsafe situations that might come up in the future. As a parent, seeing your child suffer can be excruciating. While no child should experience abuse or trauma, effective treatment can make a world of difference. We're so glad you're interested in learning about TF-CBT. To find a certified therapist in your community, visit TF-CBT.org and click on Find a Certified Therapist. Thanks for watching.